Achilles tendon rupture is not common, but it's an area that doctors and patients need to understand better in order to provide faster and more appropriate diagnosis and treatment. Delay in diagnosis and treatment of Achilles tendon rupture leads to poorer outcomes because the ends of the tendon may separate further and then heal in a lengthened position so that the muscle operates from a shortened, weaker position. Risk factors for ruptured Achilles include diabetes, certain medications including anabolic steroids, and certain antibiotics such as fluoroquinolones, and trauma. Most patients have no Achilles pain prior to rupture, and they describe a pushing off event where it feels like someone has hit them in the back of the heel. Weight bearing then becomes very painful and weak, but the remaining tendons around the ankle allow people to walk still. So this is not a sign that a rupture has not occurred. The diagnosis is a clinical diagnosis that should not require any scans. If the foot hangs at a horizontal angle and doesn't move when squeezing the calf muscle, then it's lost the tension in the Achilles and the diagnosis is made. Imaging may in fact confuse the picture so that the treatment is delayed. This is a classic example of an ultrasound of an Achilles that was indeed found to be ruptured at surgery. The ultrasound suggested only partial rupture, but hematoma can fill the space between those tendon ends, and that dry blood can look like tendon, so it can fool us. Achilles tendon ruptures can be treated without surgery, and there is published evidence supporting this when an early diagnosis is made. The key is early recognition, because a delay in putting those tendon ends together means the strength of the tendon will be compromised and it will then heal in a lengthened position, which makes strength virtually impossible to be fully recovered. Patients should be given crutches and only ever be put into a boot or plaster with the toe pointing down. We call this the Aquinas position, and it's critical in enabling those two ends of the tendon to come together. Using a boot in the neutral position will pull the two ends apart and lead to poor healing of the tendon in that lengthened position and a lot of extra scar tissue. Now, whether operative management yields superior results or lower recurrence is controversial, but the research indicates that calf strength outcomes, return to sport, confidence, and re-rupture rates may be improved with surgery. The most important thing you can do early on is have the ankle in the correct position that puts these torn ends of the Achilles in approximation so they're not being pulled apart or retracted. I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.